running for our representative in Congressional District 9. I'm really excited for us all to see and hear and learn more about each and every one of them and where they stand on the various aspects of healthcare issues today. But to start off, I'm going to pass things over here to Christina to just kind of kick things off and tell you a little bit more about why we decided to do this. So Christina, our Franklin County Democratic Party Chair.
Hi everyone, I am so happy that you all have decided to come today. We originally thought about this, we were trying to think of a fundraiser, and then with the traditional dinners that the Democratic parties have, we kind of wanted to get away from that because we felt as if candidates were not as ready available to the people. And so we came up with this idea to have a debate and serve soup. And we decided to ask Ripley County if they wanted to join us. And Ripley County said, yay, we want to join them. And the real meaning behind this is, guys, this has been a rough time. And there's a lot of people that are losing their benefits. There's a lot of people that are going to be paying exorbitant amounts for health insurance. And there's some people that are just going to choose not to pay. I'm sorry, I get emotional because year before last, I was diagnosed with cancer. And, I found myself unemployed suddenly. A program that I'd worked really hard to build through the Fayette County School Corporation closed. And pretty much the same day I was told I had colon cancer. And went through surgery, went through the chemo and all of that. But in the meantime, guys, if it wouldn't have been for HIP and the services that Indiana offers, you'd be talking to a woman who quite possibly would have had to sell her home and just change the life that I was used to entirely, just to cover medical expenses. So this debate means a lot to me because I'm hoping that our elected officials, these folks that are running for office, are going to do something to not only improve health care, but also make it accessible to everyone, so that people don't have to worry like I did about whether I would have to sell my place to pay medical bills and to survive. So that's why I'm here. It was one of the reasons that I really pushed for this to happen. I have to give a shout out to Jeff Wilson because he sort of was the person who brought up how folks that work under the union were also having trouble with health insurance policies, not covering everything and having to pay more out of their pockets as well. And we just thought, you know what? Let's do a debate. We'll have free soup, and if folks want to donate something toward us possibly doing this again, maybe on the topic of education, it would be great. But most importantly, we also wanted to make certain that everybody was included in this, that it wasn't just Democrats, it wasn't just Republicans. We wanted independents, we wanted libertarians, whoever is running for Congress, we wanted them to be welcome so that we can finally start hearing where folks stand on the issues, so that we can make good choices. So I welcome you all, and I thank you so much for coming today. And don't forget, we have free soup, we have chicken noodle, cream of mushroom, and chili. We have hot apple cider, we have lemonade and water. And if you get cold, there's the fire, stand next to there. And we have lots of folks that helped make this happen today, and I want to thank all of you that have helped us to get set up. And just, Victoria's going to take it from here, and thanks guys.
So yes, I want to echo what Christina just said. Thank you so much to the incredible volunteers who made this happen today. It was really a core group of, I want to say 6 to 7 people who put this all together. And I gotta give a special shout out to Courtney Enix over here, because she really was the force that bound us all together and set us forward on plans of action and told us all what we needed to do to make this happen today. So thank you so much to everybody who's in the kitchen right now serving food. Thank you to the members of each Democratic Party who participated to make this happen today. And thank you to Mr. Bonilla up here, our free MC for the day. He's going to be keeping us hyped throughout the day. Okay, so I didn't mention this earlier, but I am also running for a political office myself. Representatives out here, our state level equivalent of what each and every one of these incredible people is running for us at the federal level. And I'm running out here for a reason that kind of is the basis of why we wanted this to be a nonpartisan event here today as well. You know, we're in a different world than we've been in for a long time. We're in a world where the issues that bind us all together, they're not party-affiliated issues. We're in a time where it is the laboring population versus the population who owns the means of production. And we need every single person to get on board with this fight, because together, united, we will not be divided. But it's going to take each and every one of us out there talking to our friends, talking to our neighbors, talking to people in the grocery store, talking to people who we maybe don't get along with usually, but we have to get along. We have to put small differences aside and unite around the real issue. It is the lower 99% versus the 1%. And that is why an issue like healthcare is such an important issue. That is an issue that really only is an issue to us, the laboring class. For anybody in the 1% out there, they could pay any amount of money to go to any medical care institution across the globe, and they could get a world different of medical health care access that any one of us in this room ever can afford to, regardless of what level of employment you're at. And that is why we need to unite around issues like this, because it is an us versus them scenario, and it's not the one that you see being broadcast out there in the news media every day. It's not us versus the immigrant who came here fighting for a better life for their family. It's not us versus the single mom who needs Healthy Indiana plan to provide health care for her children. It's not us against the poor person who needs SNAP to be able to afford food for their children. It is us versus Jeff Bezos. It is us versus Elon Musk. It is us versus every single person out there who owns the means of production for our news media sources here in the United States. It is us versus every person out there who owns the means of production for things we order through Amazon every day. It's us versus every person out there who owns any means of production, because none of us can ever, we can dream, but none of us are ever going to get to that level of wealth. That level of wealth is only acquired by depriving the people who are making that income for you of their fair share of their value of the labor they've done for you. And that is why we have to unite on these issues. And so I am very grateful for you all being out here today to hear about where each one of these candidates stands on health care, because we need to know that. And at the end of the day, we all need to unite behind the person that does get elected for the Democratic Party to get that person all the representation support they can get when it comes to the ballot in next year's general election. We need to change things. You see here, we've got a podium for each and every person who's running for this office next year. That includes our incumbent representative, Aaron Houchin. and she didn't even dignify us with a response. This wasn't a partisan event. She was given the same notice that everybody was given. She was given the same outreach that everybody was given. And she lives about an hour and a half away from here. Some of our candidates live further than that, and she didn't even dignify us with a response. That is what I'm talking about. It is the laboring class versus the means of production class, and she represents the means of production class. Because she does not care if we hear where she stands on issues or not. She already knows who she's going to represent if she gets back into office next year. And it's not us. That's why she's not out here talking to us about where she stands on these issues. If it was about us, she'd be here to tell us where she stands. But she already knows. She doesn't care about the everyday working class person's access to health care, and that's abhorrent. That is why we're living in the time we are right now, where many of us, we're lucky if we can afford health insurance, much less if we can actually afford to go see a doctor with that health insurance. You call your health insurance company and they tell you, oh, you guys just don't have that great of negotiators at the State House. You had more benefits last year because you guys just don't have that good of negotiators on the user side of health insurance. That is unacceptable. That should never be the case. We all should have the same means and ability to access health care as every other person in society. Because truly, if we all relied on knowing that we're going to have the same level of access to health care as the wealthiest person in our community, our health care would be a heck of a lot better. They don't want to have the same level of health care that we have. They don't want to be worrying about if I'm going to have to pay $50 to go see a primary care provider for one single visit, much less discover what other issues are going to arise from that visit and then have to foot the bill for all of that as well. If we all had the same expectation of access to health care, you can bet it would be a heck of a lot better. So, I think we're in a room of friendly minds here today. I look out here and I see a lot of people who see eye to eye on this issue. And coming away from today, I would just implore you to make sure you carry this thread forward and weave it into every aspect of your life. The story of who it really is, us versus them. The laboring class versus the owners of the means of production class. Because when we get everybody united around that, we are going to change things. It's not a matter of if, it's a matter of when it's going to happen. It only takes time for us to get out there and talk to more and more people in each election cycle and spread this message further and further. Things could get worse before they get better. They very well might get worse before they get better. But the more we carry this message forward, the closer we get to that goal of really changing things. So, last thing I'll say before I let you guys go here, let's make sure we are getting engaged with and supporting our local unions. We have some amazing unions out here in Batesville. We have the Steelworkers Union out here who represents a number of different employers all across the southeastern Indiana region, all the way from nurses to actual steelworkers to people working in the Fresco beverage facility to truck companies out in Franklin County. We also have an amazing union of Teamsters up in the Shelbyville area. I don't know, have any of you seen them? Yes. The unions know. They've known for a bit who it really is between us versus them. So get engaged with that local union. They're going to help you amplify that message out. But, all right, I am going to go take a look at my notes now because I can't remember who's supposed to talk next. But thank you all so much. Okay, this is great. I just need my notes. Sorry, guys. I like to really just riff when I'm talking, and I let the spirit take me away, and then I forget what I was supposed to say. So, we are now ready to hear from our first keynote speaker, who I am really excited for you all to hear from today. So, beyond just our congressional candidates, we also have a candidate for a very high level of representation, state level office out here today. We have Blythe Potter, who's running for Secretary of State. Now, before I let Ms. Potter take it away, lifelong Hoosier. She works as a small business owner right now, but she has always served her community even before then. She is a U.S. Army veteran. She completed tours in Baghdad and Iraq, and she even served on the front lines as a personal detail for General George Casey, a driver, a gunner, and a commanding general of a multinational force. So, suffice to say, Blythe is a very powerful woman beyond even just the words that she is going to get up here and share with us today. You might look at her and see, like, what a lovely person she appears to be, but watch out, don't make her mad. She could definitely take you down. I'm scared. Okay, Blythe, come up here and talk to us. Thank you so much for being here.
Thank you for having me. All right, thank you, Victoria. Thank you all for being here. Thank you for anyone choosing to engage in politics, especially so early on for Indiana's elections next year. Being here is it's such a service to our state, so thank you. I'm Blythe Potter. I'm seeking the Democratic Party nomination for Secretary of State in 2026. And aside from making sure you're saving the date for May 5th, June 6th is when we have a convention in the state, Indianapolis, for you to vote for me should you become a delegate, and I can give you information about that as well. So today's topic is healthcare. Secretary of State doesn't oversee healthcare, but the way we get us out of the mess that we are currently in now is by voting. And Indiana's 50 out of 51 for voter turnout, and it seems like we can only go up because getting worse will be detrimental for everybody. By doing that, I want to make sure we have every registered voter gets a packet in the mail telling them about every single candidate so we can make better informed decisions on who we're voting on, what kind of policies they may be making. So when you see your congressional candidates up here, imagine being able to have some notes and information delivered to your door before you go to vote for them in May, which is something we don't have, but other states do. Currently, the average household, and this includes homes with no children, spends about $6,000 a year on healthcare, which I think that's a low number for me, $1,400 on childcare, and $1,700 a year on education. If we were to tax the rich, that would go from spending about $9,100 a year to $2,000 total for healthcare. And that would benefit everybody, not just large corporations, not just billionaires, not people who are in the poverty level, but normal, everyday Hoosiers like us. So voting on people up and down the ballot next May and next fall who are going to care about human rights, which includes health care, it is so detrimental. Thank you. Human rights can no longer be negotiable. It does not matter what side of the aisle these candidates are sitting on. If they do not put human rights above all else, to include healthcare, education, safe housing, safe air, safe water, we won't have a state or a country to live in. So thank you for being here. Ensure you are registered to vote. Check your voter registration regularly, especially women. The SAVE Act is still on the table. It is still in the Senate. It may or may not be passed by the time we go to vote next year. So make sure we're paying attention to that. Continue to share information. We're still seeing that mainstream media is not covering progressive and grassroots candidates like myself, like Victoria, like Hunter, like your candidates that you're going to see having their debate today. And make sure you're sharing that, engaging it, because the biggest thing you can do for your neighbors, your friends and family is to share information and make sure that they're getting out to vote. Thank you for being here, and thank you for having me.
Sorry about that. I turned it off for a second. All right, we are now ready for our second keynote speaker of the day. So we're obviously all here today to talk about healthcare related matters. And so our second keynote speaker is a doctor. Today we're going to be hearing from Dr. Stuart Campbell Ray. He is a professor and a specialist in infectious diseases with Johns Hopkins School of Medicine. He focuses on virology like HIV and hepatitis C type diseases. He's going to be here to talk about what happens for funding when science research gets cut. Please join me in extending a tremendous welcome to Dr. Stuart Campbell Ray.
you. It's great to be here and to talk about this topic to a group of people who understand how important it is. I think we were reminded that by Christina Person's comments about her recent journey, and I hope that goes well for her. Always poignant to think about these things. And the reason I'm here today is because I've got family here, James Ray, Rachel Ray, live just a mile or two away, and so they are here part of Batesville, and we're here to celebrate Rachel's birthday, and happy birthday, Rachel, and also to remember that healthcare is important, and that this process, this democratic process, is how we get it funded. We know that our healthcare system is broken. It's broken in many ways, and the middle layer of corporate management is cycling off a lot of the funds that should be going to healthcare. If you don't know what a pharmacy benefits manager company is, you should know. And of course, if you've ever dealt with health insurance, you know about prior approvals and denials and all these things that drive us all bananas. And doctors like me spend a lot of time dealing with those paperwork things that are ridiculous. So we struggle with this. So why am I speaking? Well, I'm a professor of medicine, so I'm an internist, and I take care of people with internal medicine problems in the hospital. I've spent most of my career taking care of the urban poor, people who are disproportionately affected by drug use disorder and the complications of that, including hepatitis C and HIV. When I started at Johns Hopkins 35 years ago, about half the patients I cared for had HIV infection, and basically all of those people were dead within 10 years, because there was no treatment that was effective for HIV in 1990. By 1997, we had medicine that was effective, and today, for most people with HIV, one pill a day is all they need to live a long, healthy life. That's an amazing transformation. And I was reminded by how much we've learned through biomedical research as I walked through this park here, and I saw the sign on the baseball field that said established in 1921. And that took me back to where we were in 1921. 1921, we were on the heels of the influenza pandemic of 1918. Now, you may know that as the Spanish flu epidemic, but you may not know that it started in Kansas. And the U.S. Government suppressed the press so that it wasn't called the American flu. The Spanish press, which was not at that point involved in the war, did not suppress the press, so when it arrived in Spain, we got news reports out of Spain that there was a new disease that nobody understood. That's why it got called the Spanish flu. So, that's a problem, that we need to be upfront and clear about what's going on in healthcare because it has repercussions long term. Now, what did we know then? Well, we didn't know what a virus was. We didn't know what was causing the pandemic. So we today have bacteria called Haemophilus influenza, named because they thought it was going to cause influenza. It wasn't. People died with that bacteria, but it didn't cause the disease. We learned Streptococcus pneumoniae. If you got the pneumovax, that's the pneumonia vaccine people get. That caused a lot of the deaths at the end of the pandemic, but was not the cause of the pandemic. It was another 15 years before people learned that DNA was at the heart of all this. And it was another 10 years after that before we even knew the structure of DNA through Watson and Crick's discovery of the double helix. So we discovered what DNA was, RNA was, there was a genetic material because of that pandemic. So the way that America responds to crisis is by researching it and figuring out scientifically what is the cause of this and how do we mitigate. Today, we have flu vaccines. And I get mine every year because I know that my patients who get the flu vaccine are far less likely to die from the flu that year. And now I'm getting old and I need it more. So I make sure I get that. As controversial as the COVID pandemic was, it's very clear that those COVID vaccines saved millions of lives. The science is very clear on that. And I'm happy to talk about that if we want to talk about it. But those vaccines saved millions of lives, and it took decades to develop the technology that made it possible for that vaccine to get developed. And it got developed fast, and it got developed through the support of President Trump. He's got lots of failings, but he did back that vaccine early on, and Project Warp Speed helped accelerate that program. So our government has a big role in making sure these things happen. And so we need to fund these initiatives, and biomedical research does that. Where does that money go? Biomedical research funding goes to American people doing the work. So it's funding jobs. The people are learning, so it's their training. They're training young people to do the same. So people are brought up, excited about what they're doing because of that biomedical research funding. Where do we get our supplies? Most of our supplies are sourced from the United States. So that's jobs for the people who develop the DNA isolation columns and the apparatus that we use to measure things in the research labs. All those things are American dollars creating American jobs. And that grows the economy because the companies that spin out, when we make discoveries and they turn into products, that's growing the economy. And we all know that there's two ways to do this. We can fight over the dollars that are there, or we can increase the value of the U.S. government's economy. And so growing the economy is one of the ways that we grow the quality of life for everyone. So biomedical research not only improves our health, it lets our kids grow up. I know my kids got their vaccines. I hope your kids get their vaccines because we know every one of the childhood vaccines that's recommended saves lives. Every one of those diseases. Whooping cough, when's the last time you saw a case of whooping cough? You don't. When's the last time you saw diphtheria? When's the last time you saw a case of tetanus? I've seen two. Believe me, you don't want to see it. We have a lot of diseases that are a distant memory. Some of them are coming back. Measles is awful. And we've seen outbreaks of measles because of doubts about these vaccines, and that does not make sense. If there's information we need to provide, we need to do a better job of that. And certainly communication is something we can always improve, but we need to hear about what we need to improve on. But biomedical research funding is a stimulus. We'll let this go? Okay. Hard to compete with the airport. I am a professor, so I almost compete with the airport. I'm a blowhard, but not an airport. Will it go up again, or yes, it's around again? Okay. Yeah, we have to say. I live near a volunteer firehouse, so we hear this out there. So I'll just continue that one of the things we need is healthcare to be more equitable. And one of the ways it gets more equitable is when we can put it in your hands. And you may not have noticed, but during the pandemic we started having these rapid tests that we could do for influenza, COVID, that sort of thing. I think we're moving toward a world where we're going to do more and more testing at home, more and more care at home. I recently had a bad illness and I needed IV antibiotics, which I could get at home because of some of the technologies that have advanced. So there are a lot of advances that can put our care into the home, which reduces the overall cost and empowers us to get engaged in our own health. And so I think it's very important to think about the world we want to live in, where you can actually figure out what's wrong, where you can do your own colon cancer screening at home, where you can do your own, fill in the blanks, because there's a lot of things we need to do until we understand what's causing some of these problems. How do we figure out what causes cancer? We need to do biomedical research. The notion that doctors like me make anything for making sure people don't know what causes cancer or have some kind of deep state thing is just ridiculous and a little disrespectful, because we live our lives trying to fix these things, and the notion that we would try to hide what we know about this, and honestly, if you give 100 people information, try to tell them to keep it a secret, there's no way that's going to stay a secret. So there's no secret about cancer. We just need to figure it out, and as the Martian said, we the science the hell out of us. So we need to figure out these causes, and that comes from biomedical research support. So I appreciate having the chance to talk to you all. I think the remembering where we were 100 years ago, where we are now, where we could be years from now, if we keep on investing in this, it's like a moonshot. And I think we have already seen, I hope you all know somebody whose life has been extended miraculously through medical research. I'll choose one example, Jimmy Carter, who had brain metastases from melanoma 15 years ago, and through immunotherapy lived until he was 100. And that was amazing. Magic Johnson is still alive with HIV because of the medicines that were developed that weren't available in 1990. So medical research will take us into a better world, and I hope that the candidates who are going to be here are in support of advancing this, which is a stimulus for our economy, is a chance for educating our young people, and improving the health of our older people so that they can live healthy as they live to a greater age. Thank you very much.
Thank you so much again to Dr. Stuart Campbell. Can we give it up one more time? We need more people out here talking to our everyday citizens about these important health questions and providing true, trustworthy, honest answers. And in light of that, I want to mention we do have the Franklin County Health Department back here. Can we get a round of applause for Franklin County Health Department? They are truly amazing. They just they got all new staff in their office over the last 2 years, and I was out there a couple weeks ago and got to meet with Ms. Schwab and her coworker, and they are just some incredible ladies who are out here doing the Lord's work, talking to the everyday citizens of Franklin County about any odd health question they could come in with, just to make sure they have access to information. And if you want to check out their table before you leave today, they have a ton of useful freebies related to healthcare questions. I think somebody mentioned they might even have gun locks back there. So please do make sure to check out their table before you leave today. Now, it is time for the main event. Woo, woo, woo. Are you guys ready to hear from your candidates? I can't hear you. Are you ready? I love it. Okay, so let's welcome up to the stage here. I'm going to start from this side. Mr. Floyd Taylor, our independent candidate for Indiana's 9th Congressional District. Next up, we have Dr. Tim Peck, one of our candidates for the 9th Democratic. Next up here, we have Mr. Brad Meyer, another Democratic candidate for the 9th Congressional District. Welcome to the stage, Mr. James Logan Davidson, another Democratic candidate for the 9th Congressional District. And unfortunately, we don't have Mr. Graham here today, but he was very regretful that he could not attend. He had previously planned to be here, so we'll give him a round of applause. Okay, so we have an amazing independent journalist here today. And wait, what up?
Where's Aaron?
Oh, that's a great question. Does anybody have any way that they feel about our current representative not being here? Yeah, I kind of feel the same. She was invited. She got the same level of notice as everybody, as I said earlier, and she did not dignify us with even a response acknowledging receipt of our invitation. So, thanks, Representative Houchin. I feel really represented. No, I don't. Like I said, she represents the owners of the means of production class. That's why she's not here to talk to her people. She knows her health insurance is covered. She's not even working right now. She's literally on a break because the government is shut down. She's still getting her full salary. She's still getting health insurance coverage, and she couldn't even dignify us with her presence here today to talk to us about what she feels about our health care insurance.
Get her out!
Yeah,
Okay.
I'm with you. We gotta spread that message. We gotta spread the message and bind us all together. Because when we are a bundle of sticks, we broken. So make sure you carry that through with you. But I want to move over here. Let's stop thinking about this. That sucks. Let's think about our amazing announcer we have here today. We have an incredible independent journalist here today who is going to be the leader of our debate. Her name is Rachel Chatham. She's sitting over here at the podium. Miss Chatham, will you stand up and wave hello? Can we get a round of applause for Miss Chatham? If you want to follow her work on social media, you can find her on all social media platforms under Chatting with Chatham, or Facebook right now, right? Yes. Okay, Facebook and YouTube under Chatting with Chatham. And again, just a reminder, this debate is being live streamed. If you want to share it on social media later with your fellow 9th Congressional District people who live there, please feel free to do so. I am going to hand things over to Ms. Chatham now.
Thank you.
Good afternoon, everyone. I'm your moderator, Rachel Chatham, and on behalf of the President of Versailles County Democratic Party,
Louder.
entirely on the future of healthcare in our district and state. We have a distinguished panel of four candidates running for the Indiana Congressional District 9 seat, all of whom recognize that healthcare is one of the most significant and personal issues facing our community. Today, we delve into the specific healthcare challenges our constituents face, from statewide policy to the crucial needs of our local communities and the financial burdens on small businesses. Before we begin, let's review the rules that will govern tonight's discussion.
We still can't hear you.
Candidates will have up to 2 minutes to answer each question.
Better when you're close.
Candidates will have up to 2 minutes to answer each question. I will raise a yellow card to indicate when 30 seconds remain and a red card when the 2 minutes are complete, at which point the candidate must conclude their statement. A candidate may request a 30-second rebuttal only if their name is directly mentioned by the opponent. To request a rebuttal, please raise your hand immediately. Once recognized by the moderator, you will have 30 seconds to complete your rebuttal. To ensure a structured and timely discussion, rebuttals will not be permitted. Candidates are permitted to refer to notes during the debate. We will begin with a 2-minute opening statement for each candidate. This is your opportunity to introduce yourself, briefly share your campaign's vision, and outline your general approach to healthcare. We will proceed in alphabetical order by last name, starting with Mr. James Logan Davidson. James Logan Davidson.
Hello, folks. My name is James Logan Davidson, and I'm proud to be running as a Democrat for the 9th District. Listen, we're going to hear a lot about statistics today from all of our candidates up here, including myself, but I just want to be completely honest with you. I not only have been a statistic, I continue to be a statistic. For the first 25 years of my life, I was uninsured. And my health care was a hospital. Okay, it was the emergency room. And me and my wife are two proud teachers. And we still struggle to pay to afford our health insurance in the richest country on earth. And listen, you know, in an ideal society, we would have already fixed this horrible problem to have. We would have universal health care. I'm a proud supporter of universal health care, but we don't live in an ideal world. Because of dark money in politics and congressional gridlock, unfortunately, that is not on the table at this time. But what I do support is a public option. It's long past time that the working poor and the working class had an option, an affordable option for healthcare. And, you know, we may hear some things today about how can we afford that, but I want to be unequivocal at the beginning. We're already paying for it. We have the highest cost of any nation in the world. We spend $5 trillion a year on our health care. We're already paying for it. So I have the pleasure today to be here and discuss to you how we're going to get there.
Hello, I'm Brad Meyer, and I'm running for the U.S. House of Representatives in the 9th District. Thank you. So, I've been a strong supporter of universal health care for many years, and since I started running, I've had 2 health care forums, one in Bloomington and one in New Albany, discussing as a panel what the problems are. And I'm not a doctor, but I am a member of Physicians for the National Health Program. I don't know if anybody else is a member of that, but I feel very strongly about this because we on average die 4 years earlier than people in similar countries. We have the highest infant mortality. We have the highest maternal mortality. We are the only country in the world, in the developed world at least, which you can go bankrupt just trying to stay alive. The fact is that of the people that are carrying medical debt, which there is a significant number, and in fact in Indiana, we are ranked 11th in the percentage of people that carry medical debt. Those people, 80% of them have insurance. So it's not just a matter of poor people carrying medical debt, it's people that are covered by the existing system. This existing system has been proven that a for-profit system and a non-profit system are incompatible. Because when we have tried to have a non-profit government-run system like Medicare and Medicaid, and when we tried to make improvements like the Affordable Care Act, the politicians undercut and undermine what we're trying to accomplish. And in fact, it's happening right now. We're all going to see it. The government's shut down because we're trying to fight against it. I believe that we are going to have much stronger legislation. And frankly, we talk about it's a right. It's actually constitutionally not a right in the United States, and that's why I have put forward a proposal to have a constitutional amendment added, because it has to be a true constitutional right if we're going to overcome these problems. Thank you.
Thank you, Mr. Meyer. Now we will have Tim Peck.
I'm Dr. Tim Peck. I'm an emergency physician, and I live in a healthcare desert. I live on a 40-acre farm in Clark County, and the nearest hospital used to be in Charlestown, and it closed down about 10 years ago. And when I say goodbye and kiss my wife and my child, when I go to work at night at the nearest open emergency department 40 minutes away, I know when they call 911 that there's about 90 minutes between that call and seeing me in that emergency department. I became a doctor to help people. When I treat someone, I don't ask what party they're from. I don't ask how much money they're making. I don't ask what country they're from. I just help people. The world is burning. Unions are being broken. We can't afford our groceries, and Congress is literally doing nothing. As an emergency room physician, I've said a lot of broken bones, but know what I've never said is a Democratic broken bone or a Republican broken bone. I've never pulled a partisan bullet out of a child. I've never held the hand of an independent elderly patient as they were scared they wouldn't make it through the night. I have only treated mothers, daughters, brothers, fathers, neighbors. Every person deserves health care. Health care is a human right. I've been a patient, I've been a provider, I've been a caretaker, and I've helped telemedicine bills in Congress that have saved the lives of millions of Americans. I helped pass those. And if you elect me to Congress, I will deliver health care for all. Thank you for being here, and thank you, Rachel.
Thank you, Dr. Peck. And now, Mr. Floyd Taylor.
I'm Floyd Taylor, and I'm not going to give you party slogans. I'm here because the bill comes due at the ER, the pharmacy counter on Main Street, and families are getting crushed. That's why I've written real legislation to fix the cost at the source. The Rural Mobile Health Access Act puts mobile clinics in towns that lost their hospitals, funded with existing dollars, capped at 5% overhead. Preventative care beats midnight ER visits every time, and it saves billions. My Medicare bill makes the program what it should have been all along. Dental, vision, hearing, prescriptions, all covered in full. No deductibles, no double billing. My Medicaid bill cleans up waste with real-time eligibility checks, transparent drug pricing, and telehealth parity so rural families don't have to drive 2 hours for care. And the Main Street Health Compact guarantees every American a baseline of affordable coverage, forces insurers to compete under transparent benchmarks, and funds itself responsibly. No more hiding behind subsidies or secret contracts. And here's the difference. I'm not asking you to take my word for it. You can read every bill, the full text, the plain language explainers, and the fiscal impact statements, and then support or oppose them yourself, right now in the Congress app. That's radical transparency, and that's how we put the power back in your hands. Thank you.
All right, thank you, gentlemen. We will begin our first round of questions. All right, do you advocate for federal policy that aims to aggressively expand the Medicaid model to more citizens, possibly through a national buy-in, thereby retaining a role for private insurance? Oh, yes, and let's start with Mr. Meyer this time. Let's start with Mr. Meyer this time.
So, yes, unequivocally, yes, we need a national healthcare system that is run by the government. There are, and I'm a paper person, so I did some research on all of the different government-run healthcare systems. And we have Medicare, we have Medicaid, we have CHIP, we have the Indian program, we have one for active duty, we have one for veterans, we have a lot of experience. And half of the people in the United States are already covered by a government-run system. And what we have seen is that 70% of people are in favor of a national health care program, and it seems like 0% of the politicians are in favor of it. And the reason is because the insurance companies will spend as much as they have to buy off politicians to keep anything that could work better and save money out of our hands. And they've undermined the Affordable Care Act and everything else that they can do to undermine this. They have shown themselves to be incompatible with a system that gives us a longer life and better health care.
Thank you, Mr. Meyer. Next, may I have Floyd Taylor answer the question, and would you like it repeated? Okay. Do you advocate for a federal policy that aims to aggressively expand the Medicaid model to more citizens, possibly through a national buy-in, and thereby retaining the role of private insurance?
I support the idea of expanded Medicaid or Medicare, but those programs are bloated now and they're inefficient and they need to be fixed. I've got a Main Street Health Compact that guarantees everybody gets affordable coverage, whether they need Medicare, Medicaid, or not. So technically, I support the idea, but I don't support expanding Medicaid itself.
Thank you, Mr. Taylor. All right, now may we have Dr. Peck?
Healthcare is a human right. Everybody deserves healthcare. And if you don't have coverage, my plan will get it for you. If you like your union plan, you get to keep it. And under this plan, no one goes bankrupt for going sick. We'll level the playing field so small businesses get the same deals with insurance companies as giant corporations. We're building a bold and ambitious system where everyone has the same power. Everyone has the same power to choose the plan that works for them. It's healthcare your way, not Washington's way. My plan starts with the simple truth: you can't fix healthcare by pouring more money into a system that's already designed to waste it. Right now, half of every healthcare dollar goes to executives, middlemen, TV ads, corporations, and shareholders, not to patients and providers. My plan takes those costs out of the system so that every tax dollar goes where it should, which is straight to patient care. That means reopening rural hospitals, paying nurses fairly, and letting healthcare decisions be made by patients, not a commercial on TV or an insurance company's algorithm. We will deliver healthcare for all.
Thank you, Dr. Peck. And Mr. Davidson, would you like the question repeated? Okay.
No, as I said at the beginning of my introduction, I support a public option. And obviously, I don't think that anyone should go bankrupt for their inability to afford health care. Now, I also support a Medicaid expansion because, let's face it, it is costing more and more money to be an American. I think our poverty rate is probably higher if we expand where it actually should be. Not only that, but some of our candidates here have talked about we have to lower cost. Some of the detriment that we get into when we start to have a conversation on how we transition, as I said in the beginning, was how are we going to pay for it? We're already paying for it, but the government is the only entity that's big and strong enough to actually come in and lower our healthcare costs. And not only that, but I think it's anti-business. It's anti-business to expect corporations to pay our high healthcare premiums. You know, our current president wants to bring manufacturing back to the United States. I'm in Ripley County. I'm from Washington County, where Aaron Houchin's from. I share some of those concerns. We have to bring opportunity back to the United States, right? Some of the detriment to that is the cost of healthcare. Let's bring it down. Not only that, I used to work with entrepreneurs. I was big in helping entrepreneurs start their business. And one of the biggest detriments to someone going out on their own and beginning their own business is not only the cost of health care for themselves, so I'm going to quit a job with good health care and go out on my own and try to get insurance through a private market, but how do I retain talent? How do I keep somebody from going to Humana? This would be the most American, the biggest move towards opportunity economy that we've ever made, and we cannot let Republicans own the conversation on it. This is the most American pro-business thing that we could possibly ever do. It's not just about the customer or the patient. Thank you.
Thank you, Mr. Davidson. All right, our next question kind of ties into the last one. What policies would you propose to handle insurance monopolies? Let's start with Mr. Taylor this time. Did you hear that okay? I can repeat it.
I've written the Main Street Health Compact that gives everyone baseline of care. And it goes the opposite way of the ACA, where the government doesn't pay insurance companies to treat you, it pays the provider. The insurance companies can get in line and try to compete for your business, but they'll have to compete because everything will be public, everything will be on a dashboard, you'll be able to see exactly what you're getting. And in most cases, they will be out of luck because you'll have a public option. That's what I think about insurance.
Thank you, Mr. Taylor. All right, can we switch to Mr. Meyer?
Thank you. So, in my plan, private insurance is not part of it. Private insurers spend 12 to 18% of the dollars that they bring in on administration. The cost for Medicare, Medicaid, or government to do administration is 1.3%, 10 times lower. And people talk about, well, we don't need a government bloated system, we don't need Washington involved. Yes, we do, because they do a dramatically better job and they care for about half of the people without the enormous cost. Most retired people are covered by this, and in fact, you try to bring them into the system and you try to engage them. And Medicaid Part C has hundreds of billions of dollars of waste in it that we could have saved if people had been in Medicare A and Medicare B. It's not a system that works. We tried to play nice with the insurance companies and bring them in and use market forces for the Affordable Care Act. And in response to that, the Republicans forced us Democrats to bring it in and bring in the public response. And then after we changed from what we really wanted and really needed, they didn't vote for it anyway. So there's no reason to compromise with people that are going to walk away at the last minute. And then they spent the next 15 years saying, hey, we've got a better plan, but they didn't have a better plan. They have tried 100 times to undermine the Affordable Care Act in Congress, 60 times in the Senate, and all of that undermining is the result of billions of dollars being funneled to congressmen by insurance companies and healthcare providers. They are the corrupting force. We spend 18% of our total GDP on healthcare. European countries spend 9%. We spend twice as much for worse care. And it's because we have allowed the for-profit motive to stay in. They are not better at administrating. It is not a bloated system. The bloated system is the one that costs dramatically more, and that is the one that's for-profit. And the profit is being made off of our death and suffering.
Thank you, Mr. Meyer. All right, Mr. Davidson, would you like the question repeated?
So, as I mentioned, first and foremost, if we're having a conversation on this, we have to talk about dark money. So the first thing that I can do, that I can control, is say no to no corporate super PAC money. That's what we have to do. We have to get dark money out of politics. Secondly, I do want to make a caveat here. We have a legacy system. We have a bloated insurance system. And although I do think that some execs are making too much money, we have to be careful as a government. This is not a regime change here. We cannot forget the millions of Americans that have just regular jobs for these insurance companies. What are we going to do about them? So we also have to consider that as well, because we don't want to put people out of jobs. You know, right now the government is making it their mission to make people jobless. That should not be the role of government. Secondly, we really have to focus on Messaging. Messaging is going to be the most important factor of any conversation that we have when it comes to insurance companies, because if we can't get the dark money out of it, they have a better message. We have to sit down and realize that for patients, this would be a better option. For even corporations and businesses, for entrepreneurs, for children, all of this is a better option. The only entity that is harmed in this situation is the private healthcare insurance companies. Okay? So are we willing to allow our country to go bankrupt for people to not be able to afford healthcare bills for the profits of some health insurance companies? That has to be it. 99% of America would be made better off if we fix this problem. And as I've said, it's an ignorant problem for a civilized society to have.
Thank you, Mr. Davidson. Our next question has to do with the ongoing government shutdown. The current government shutdown has stalled action in Washington with millions. Oh, I forgot. I'm sorry, Dr. Peck.
All right, thank you. I want to make the plan very clear on how we get monopolies to dissolve, to not be strong. These insurance companies, of which I've been fighting for many years, both as a clinician and as someone who's owned physician groups and operated them, having to fight the insurance companies for every single dollar for the patient. Money from taxpayer money should not go into the pockets of executives. They should not go into billion-dollar ad campaigns that go into your living room. They should not go to prior authorization that gets in between me and you when we're trying to get you the right test. So when a federal tax dollar goes to pay for healthcare, it needs to go directly to the patient-provider interaction. If it doesn't, if that insurance company uses it for their shareholders, uses it for their executives, uses it improperly, we will claw that money back from them and fine them for doing it so they never do it again. I believe in a public option to compete with the insurance companies. However, I want to make something clear. I heard a number up here that Medicare has 1.3% overhead. Medicare does not do most of the work of paying for healthcare. They have to work with the private insurance companies currently to administer the bills, to work with the pharmacies. They have to work with corporations. If we don't tamp down the corporations, Medicare will continue to be subservient to insurance companies. Thank you.
Thank you, Dr. Peck. Sorry about that. The current government shutdown has stalled action in Washington with millions of Americans facing uncertainty. At the core of the impasse are the negotiations over healthcare spending, specifically the Enhanced Affordable Health Care Act subsidies set to expire at the end of the year. Should Democrats vote to immediately open the government with a clean bill and defer the fight over the expiring ACA subsidies, continue the shutdown and refuse to vote for any funding unless it includes a permanent extension of the current ACA subsidies, or use the leverage of the shutdown to demand an even greater expansion of government-backed health care, such a vote on Medicare for all or reverse public opinion. Please state what strategy you would support and justify your choice by weighing the political risk, the immediate cost to the American public, and your ultimate vision for healthcare in this country. Let's start with Davidson.
So this is a very poignant question right now, and it's not an easy answer. Of course, in a scenario like this, you want to think that we can use the little bit of leverage that we have and fix the problem, which this problem's big. I mean, I said at the beginning, every single American, including people in this audience and people watching at home, your insurance premiums are going to go up no matter if you qualify for ACA subsidies or not. And as I said, this is the only leverage that Democrats have right now. What I will say is that we have to weigh our leverage with the ramifications of that leverage. There will be people that in December, especially with our current administration, that may not have food on the table. So, although I do agree with it, and I think that we should fight for the ACA expansion, I am nervous about the economic outcomes. So we do have to weigh that. It's time sensitive, but right now we have to use that leverage because people just won't be able to afford health care. And I heard a statistic the other day that 50,000 people will die. So that's part of the calculus too. I agree with what Democrats are doing, but we also, it's just a hard situation. I don't know how to give you an answer that is the correct political answer, but right now this is a horrible situation that we find ourselves in. And to be honest with you, one of the things that Congress has to stop doing is stop playing the blame game, and we have to get to work and find solutions for Americans.
Thank you, Mr. Davidson. Mr. Taylor, do you need the question repeated?
Please.
Okay. The government shutdown has stalled action in Washington with millions of Americans facing uncertainty. At the core of the impasse are the negotiations over healthcare spending, specifically the Enhanced Affordable Health Care Act subsidies set to expire at the end of the year. Should Democrats vote to immediately open the government with a clean bill and to defer the fight over the expiring ACA subsidies, continue the shutdown and refuse to vote for any funding bill unless it concludes a permanent extension of the ACA subsidies, or use the leverage of the shutdown to demand an even greater expansion of government back to healthcare, such as a vote on Medicare for all or a robust public option. Please state which strategy you would support and justify your choice by weighing the political risks, the immediate cost to the American public, and your ultimate vision for healthcare in this country.
No. I've read the CR, and it's anything but clean. I think that they should stand firm. I think that they have no choice. Anything else is going to hurt people. I mean, people are going to be hurt anyway, but without it, my medical insurance bill just doubled this year, and that's a lot of money. I can't afford it. I don't think anybody can afford it. My insurance bill is probably more than most people make. So I think they should fight it out. I mean, there's going to be pain no matter how you do it. So stand firm. Thank you.
Thank you, Mr. Taylor. Dr. Peck, would you like the question repeated?
I'll never compromise democratic ideals. Right now, democratic ideals are suffering with what's happening in DC. 42 million people are losing their SNAP benefits and not being able to feed themselves. There are tens of millions of people who will lose their coverage from the ACA, from Obamacare, if we don't find a way forward in Congress. Democrats need to stand firm on those things, but we need to move forward so that people can get SNAP, so that people can get health care. So what I'm proposing is to work with Republicans and put forward a bill that allows for us to continue the government as it was before the shutdown for 6 months, and have it so that we can actually work together to make sure at the end of the day, everybody keeps their SNAP, everybody keeps their health care, and in fact, we can fight for health care expansion as Medicaid and Medicare have been cut by the Republicans. That's the plan. We need to feed people, and we need to get back to work in DC. Thank you.
Thank you, Dr. Peck. And now, Mr. Meyer, would you like the question repeated?
It was very long, but I think I got it. Okay, so the question is, should we cave and reopen the government? And the answer is no. You know, I started, again, a paper person. I started to try to make a list and understand all the effects of the big, beautiful, or bad bill. And the bottom line is they are trying to obscure everything they can, so it makes it hard for people to understand what they can and can't get. They're making it intentionally complex so that it's harder for you to get benefits once you understand it. And they're making it intentionally denial-based so that once you understand and once you can try to get it, they're going to say no, and then they're going to undercut it. And what they're doing with this is they've got us, again, for the 100th time, on our back foot. Right? So we're not arguing over how can we make it better. We're arguing over whether we can make it suck as much as it did last year. Right? And we need to stop trying to just, they're shaving pieces of our society off on the floor, and then we run around to try and pick up the scraps off the floor. We need to start advocating for what we really need, which is universal health care. And it needs to be nonprofit, government-run health care. So, yes, we have to leave the government shut down. And I'll tell you, I worked for the Navy as a civilian employee for 9 years, and I am sick to death of hearing about CRs. The fact is Congress's primary job is to schedule and run a budget. And every year, they get worse and worse about doing this, and they go into a CR, and a CR says, we're not going to negotiate over what we spend next year. We're going to keep in place what was done last year. The entire last year was under a CR, no budget. They've done this several times. In my opinion, and people say, well, if the government's shut down, I think Congress should not be paid. No, I think if the government is shut down because they didn't get a budget done, they shouldn't be allowed to stand for election in the next cycle. They need to get out of their job. They're not doing their job.
Thank you, Mr. Meyer.
Is my time expired?
Yes.
Thank you.
All right, we do ask that you hold your pause until the end of the debate, just to get through these. The next question is, cancer rates are higher in rural areas. Recent reports showing environmental relations. What plans do you have to help with preventative care plans for those currently affected? And we're going to start with Davidson.
I'm so glad that you asked that question, because I was in the fitness industry for about 10 years, so I was what I perceive to be a form of healthcare, and that's something that doesn't get talked about enough. We do not talk about the prevention of disease instead of the treatment of disease, and the reason that we don't do that is because of our for-profit sick care system. It is much less expensive, or it's much more profitable to treat symptoms than it is to cure a disease. Not only that, we do not take into account the environmental impacts of not only workplace stress to environmental stress. I'm in Washington County. We have some of the higher cancer rates in the state. And some of that is environmental. It's also lifestyle related. It's access to health care. It's all of these interrelated things. If we're going to have a conversation about health care, we have to make it broader. We have to start talking about our found environment. We have to start talking about how we can incentivize healthy behavior. And if our healthcare system's not doing that, then maybe we need a different one. So if you want to lower cost, we have to have this discussion as a society. If we're going to lower cost and then be able to pay for it, we have to have that discussion. And that discussion is not occurring anywhere, especially in the political spectrum, because of the big money I keep referring to. And we have to transition to a healthcare model and not just a sick care for-profit model. So I think some of that, as we transition to that, I haven't heard it from these guys. I would love to hear what they have to say about that. But again, we can't transition to a universal healthcare system or a public option, I think, unless we also change how healthcare is provided.
Thank you, Mr. Davidson. All right, Mr. Meyer, would you like the question repeated?
Sure.
Okay. Cancer rates are higher in rural areas, recent reports showing environmental relations. What plans do you have to help with preventative care plans for those currently affected?
So I'm going to do something that pains me greatly, and that is I'm going to agree with Dr. Peck. I think it is, because I think telehealth and telemedicine is going to be an important part of solving the issues with the rural poor. It's an important piece of the solution, and I don't disagree with him about that at all. You know, Indiana, has a high percentage of rural residents, and as a result, we are 39th in life expectancy, and again, that's even on top of the 4 years that we die earlier nationally average. So it's more like 6 to 8 years. There are environmental issues, and protecting the environment is something I'm not going to get into in this, but we need a healthcare system that people can get what they need when they need it. I think telehealth is a good option for that. One of the things that we're all worried about right now is rural hospital closures. And there's been a lot of hospitals that's gone out and reduced the amount of services that they are able to provide. And one of the things that some people, and I don't think anybody up here is saying, well, you know, a for-profit system will take over and the hospital will remain. Interesting fact, they did a study of what happens when systems are converted to for-profit, and the emergency room death rate in that study went up by 13%, going from nonprofit to profit. So if you want to talk about the for-profit medical system, 13% death increase in the emergency rooms. Thank you.
Thank you, Mr. Meyer. All right, and Dr. Peck, would you like the question repeated?
Chronic conditions are very high in rural areas, yes? And what we do about it? Thank you so much for the question. America has over 25 million people who are uninsured. What do you think the uninsured rate for white-collar workers is? It's about 2%. What is the uninsured rate for people who are farmers, for people who drive trucks, for people who work hard with their hands? 28, 29%. People in rural areas are the ones who suffer from not having a public option and a way to make that public option for them to get health care. We need that option to give them health care to be able to make sure that we have preventative care which saves money in the long run. It is expensive to be sick in this country, and that needs to stop. Thank you.
Thank you, Dr. Peck. Mr. Taylor, would you like the question repeated?
This one hits especially hard for me because a two-time cancer survivor, I do not enjoy having to drive to Louisville every time I need to get care. I mean, it's 45 minutes each way, and it's a real pain in the ass, excuse my French. I propose a Rural Mobile Health Access Act that puts mobile clinics in every community. Maybe not every day, but every couple of days, so you don't have to worry about having to drive to Louisville just to get a checkup. You don't have to worry about going 2 hours just to get weighed and measured. You can go, you can get checked, and it costs you nothing. If you don't afford it, if you can't afford it, no cost. That's my proposed solution to the problem.
Thank you, Mr. Taylor.
Sorry guys, I just wanted to interrupt for just a second as the MC. We're hearing from some people in the back. It's hard to hear what the speakers are saying with side conversations. So if we could hold our discussions till the end, and then also let's hold our applause until great. And let's hold our applause until at the end of the debate. Okay, that's all. Thank you.
All right, because of Indiana's abortion laws, some doctors are worried about treating women who have serious pregnancy problems because they fear being sued or arrested. What will you do to make sure doctors can quickly treat a woman who is in a medical emergency without having to check with their lawyers first? And we'll start with Mr. Davidson.
What simple answer to this? What happens in a hospital room or with an OBGYN between a woman and her doctor is none of the government's damn business. I mean, let's be honest there. Secondly, I think that there is more common sense agreement on this issue when you get into these tangible things. I think even we see this in Indiana. We have an abortion ban here, and I think we can have common sense conversations with even Republicans about certain elements of, certain situations. So I think that that's something you have to fight for. No woman should have to die because she didn't have a choice. That's something I stand for, and that's something I'll fight for in Congress. It's a pretty simple answer.
Thank you, Mr. Davidson. Mr. Meyer, would you like the question repeated? Because of Indiana's abortion laws, some doctors are worried about treating women who have serious pregnancy problems because they fear being sued or arrested. What will you do to make sure doctors can quickly treat a woman who is in a medical emergency without having to check with their lawyers first?
So I would disagree with one part of the question. I would say not just some doctors, I think many or even most, and I think when Dr. Peck gets the microphone, he'll expound upon that in detail. This should be an issue of medical care between a woman and her doctor, period. But unfortunately, it is a political issue right now. And as long as we are politically weak, we are never going to be able to get politics out of the doctor's room. And that's one of the reasons that I'm running. Short and sweet.
Thank you, Mr. Meyer. And Dr. Peck.
I'm an emergency physician. I've treated a lot of women who've been raped. I've treated girls who've been raped. This week, I treated preteen who's been raped. And never once, when giving my counsel in that exam room, did I think about what the government had to say. I still don't think about what the government had to say. I've taken an oath to do right by the patient, and then all else will fall into place. And if I do right by that patient, and it brings me before the Supreme Court, so be it. This issue is going to the Supreme Court because myself or one of my colleagues is going to get into this situation. It is inevitable because women are in pain. Women have their lives threatened every day. This is not something that we've imagined. This is a real problem for women, their families, and their faith. Thank you.
Thank you, Dr. Peck. Mr. Taylor?
I'm just going to have to agree with all my fellow constituents here. It's a medical problem. It should never be a legal problem. If I had to fight for it, I would fight for them. I'll pay for their lawyers, I don't care. That's all I have to say about that.
All right, the next question is related to the last. Additionally, if elected to Congress, would you vote in favor of legislation that codifies the core protections of Roe v. Wade into federal law, establishing a national right to abortion access up to fetal viability? We will start with Davidson.
Right. So the first question was a medical question, and now we're into the politics of it. Let's be honest, in the 9th district, this is a hot button issue, unfortunately. And, you know, I think that we have to lead with our conscience and morals and ethics on this issue sometimes. And yes, I would support that. I think that we have to message it correctly. And that's what it comes down to. I think that we're just getting beat on messaging. And, you know, I have some interesting concepts on that, on how we can message it, based on what I feel. You know, my friends and family all would probably disagree with me on this issue, but if I set them down in a room and we have a conversation, they end up agreeing with me. This is a medical issue that we've turned into a political issue, so we have to message it as a medical issue.
Thank you, Mr. Davidson. Mr. Meyer, would you like the question repeated?
I think I got this one.
Okay.
Okay, so yes, I would support a bill in Congress that provides a federal right. Unfortunately, I don't think it's going to be upheld. The reason is when they overturned Roe v. Wade, they were very explicit in saying they're pushing it back to the states. So if the federal government tries to get in and put a law in place that says it is federally accepted, it's going to go back to the exact same court that said it should be a state issue. So yes, I would sign it, we would fight it, but I don't know if it would hold up constitutionally. I believe that I have proposed, and if you look on my website, bradmeyer.org, in the healthcare section, I actually have a section in there about a constitutional amendment for healthcare. And I believe that abortion should be enumerated explicitly in that, and it would eventually put it to rest. That is a very long-term strategy. Short-term strategies, we're going to have to go state by state. In Indiana, we're going to have to start winning as Democrats, and y'all are going to have to start supporting Democrats and bringing friends and neighbors in and getting Democrats in, and we'll change the state law, because that is probably the thing that will be upheld. They didn't say that it was illegal, they said it was a state issue, and then our state rolled over and took it away from us. So we need to start there. It's a tractable problem, and it's something we can do right bloody now.
Thank you, Mr. Meyer. Dr. Peck?
Day one of Congress, I will support or submit a bill to restore abortion rights to all Americans. Thank you.
Thank you, Dr. Peck. Mr. Floyd? Or Mr. Taylor?
Of course. Simple answer. Of course I would. There's no reason not to.
Thank you, Mr. Taylor. All right, misinformation has become a major threat to public health, specifically widely debunked claims linking vaccines to autism, often amplified by high-profile figures, directly undermine efforts to achieve community immunity. If elected, how would you leverage your position in Congress to effectively combat and counter dangerous health misinformation? Davidson?
So first off, I am a special education teacher, so this is an issue that's firsthand for me. I've dealt with misinformation with students or children with autism for a long time now, and this all comes back to messaging. So how do you out-message outlandish information? I see some people rolling their eyes in the audience. I don't know if I necessarily have the solution to this. This is, of course, we can talk data, we can talk statistics. One of the things that I think we can go back to our earlier question on environment. If we're trying to find an environmental cause of autism, for example, why are we targeting vaccines, right? Why aren't we targeting particulate matter that's going into our water? Why aren't we fighting for clean water? Why aren't we fighting for cleaner food? Why aren't we fighting for cleaner environment? I mean, you know, this is such a weird space that we're in, and where we can target something that is beneficial to society as the cause for something, but yet if I make the claim that I want cleaner water, and I want cleaner air, and I want healthier food for the populace, that's unattainable? Okay, so I think that's where we transition to. If you want to make the claim that autism is caused by your environment or something you're putting into your body, then okay, let's make that claim. Let's clean up our environment. How about that?
Thank you, Mr. Davidson. All right, Mr. Meyer, same question.
So I've been talking a lot about, I believe that we need a constitutional amendment, and I do believe that, but I also recognize that that is a very long road to hoe. And if you look at what I have written down, it covers universal right and scope of care, cost guarantees, finance mandate, provider choice, workforce development, accountability mechanisms, enforcement and review, and implementation timeline. And that, almost none of it has to be in the Constitution. I believe it's necessary because it's the only way to keep crazy people out in the long run from sabotaging or undermining our systems. But almost everything in there can be broken out and submitted as laws to be acted upon immediately. And that's one of the things that we need to do. We need to put laws in place, excuse me, and what I was advocating is that there need to be annual metrics that are submitted by our healthcare system so we can all see whether we're trending in the right direction or wrong direction. And if we're trending in the wrong direction, states' attorneys general should be allowed to sue the federal government saying that they are not doing their job. You know, I don't want this to get into a tort reform thing where we've got this lady's upset, so she's going to try to get $20 million out of the federal government. I think the state's attorneys general would be the right people to challenge that. But right now we have crazy people in charge of very important systems, and we've got to get them out, and we've got to, and one of the ways we can do that is show the harm that they're causing, and it needs to be public. And right now, the federal government is taking information away from us so we can't see the harm they're doing. They're doing it in education, they're doing it in health, they're doing it in safety. So I believe that we need to take concrete steps, that we get tripwires that tell us how things are going and be able to take action against it. Thank you.
Thank you. Thank you, Mr. Meyer. Please hold applause until the end. All right, Dr. Peck.
Would you repeat the question? It's about vaccines?
Of course. Misinformation has become a major threat to public health, specifically widely debunked claims linking vaccines to autism, often amplified by high-profile figures, directly undermine the efforts to achieve community immunity. If elected, how would you leverage your position in Congress to effectively combat and counter dangerous health misinformation?
Thank you. About 2 or 3 months ago, a businessman and an environmental lawyer stood up in front of the world and told people that Tylenol caused autism. It does not. I can promise you that. And I know that because I've learned how to read scientific studies, and I know from those studies that the way it works is that if it's raining, your umbrella didn't cause the rain. The Tylenol didn't cause the autism. When you look at the studies, there is no evidence for that. And I need to make that clear as a doctor to patients. How do we roll that back? We need to vote, and we need a new administration. We need a new Congress who will support science. The NIH has lost its ability to give grants in 1,000 different ways, and we need to restore that. There have been panels of vaccine experts that have been removed from the CDC that we need back. The infrastructure for making sure that people get vax has been dissolved. The first step, and this is something that Congress can do, is oversee the executive branch. Stop giving the executive branch the ability to do anything it wants, and make sure that that executive branch upholds science. Thank you.
Thank you, Dr. Peck. All right, Mr. Taylor, would you like the question repeated?
I think this is pretty simple. We just have to make sure that everybody that's appointed to a position in government or a cabinet position is just competent and qualified. That's it.
All right, we've just finished our first round of questioning. Does anyone need water or anything? All right, let's keep going. The 9th District is largely rural, and Indiana faces significant risk of rural hospital closures and service reductions, particularly for high-need services like OB and chemotherapy. St. Elizabeth and Lawrenceburg is one of the many birthing centers that have closed. If elected, what specific federal legislative action would you champion beyond general funding to stabilize struggling rural hospitals in District 9 and combat maternity deserts for expecting mothers? And we'll start with Davidson.
Right, so Erin missed the beautiful drive-in this morning. I'm from Washington County, the same county that she's from, and our Salem Hospital, which is the closest hospital, and is at risk of closure. So I don't think anyone quite understands the detrimental effect of not having a hospital would have, not only for the patient who's dealing with a medical emergency, but also for attracting businesses and providing a quality of life for the people of Washington County. So first and foremost, we have to enhance the limited funding that they put into the big, beautiful bill to ensure that rural hospitals don't close. But also, let's talk about, you want to talk about autism, right? You want to talk about Indiana is statistically one of the worst states for neonatal care, for prenatal care, and for the outcomes of mother. So we have to, on day one, that's what I'm going to fight for. My family is the most important thing to me. We have to invest in the next generation of Americans, and we don't just invest in them, we invest in their education, we invest in their food, we invest in their health care. We have to invest in mothers and children.
Thank you, Mr. Davidson. Mr. Meyer?
So this is, I tend to talk in numbers and I tend to think in facts. I'm an engineer and I just can't help myself, and as I've been saying, also I believe strongly in paper. But really these issues are about humans, and it's the life and death and suffering of all of us. And I keep going back to universal nonprofit healthcare. If you look at Canada, which I think is the largest nation in the world by landmass, they have a lot of distributed population and they have better outcomes than we do. If you look at Australia, that has, I think there's fewer people that live in Australia than live in one single town or city in China, and they have a huge continent and it's very dispersed, and they have also found a way to take care of the rural poor. The reason that hospitals are shutting down is that they are not financially viable. And why, in the name of Sam Hill, is financial viability the issue that makes or breaks a hospital instead of care? There are people that need the care, and we need a system that supports those hospitals so that they don't die. And they're dying dramatically earlier, like 6 to 10 years earlier than people in other countries. The rural poor need a lot of help, and this for-profit system, again, is not profiting us.
Thank you, Mr. Meyer. Dr. Peck?
We don't have a healthcare system, we have a system of abandonment. There are 3 hospitals in Indiana 9, in our district, that will close once the Medicaid cuts that are just voted in the big beautiful bill are implemented. Those hospitals include Harrison Hospital, Salem, and North Vernon. I've been to North Vernon in their emergency department and shadowed to see what was going on. What was so surprising there, besides not being able to deliver a baby in that hospital, was they don't even have security in that hospital. They had to cut the security to save money there. Harrison Hospital just rolled back its OB program and you can't give birth there. We talked about St. E's where you can't give birth there. This is an epidemic that's occurring. And in order to get back our ability to give OB care, we need OBs to stay here in Indiana. And when you look at IU's graduation rate, when these doctors become OBGYNs, where do they go? They used to, at about 70%, stay here in the state. Now, at about 30%, they're staying in the state. And the other 70 are going to blue states where they're not going to be persecuted. One last question, one last thing. At the very, that's what we need to do in the big picture. In the immediate, we need to put up more standalone emergency departments so that those places, I can deliver a baby, put me in the rural area in a cost model that doesn't cost as much for today until we can insure everybody and open these hospitals back up. Thank you.
Thank you, Dr. Peck. Mr. Taylor?
I propose legislation, the Rural Mobile Health Access Act, that actually puts clinics in places where hospitals have closed. It's funded with existing dollars and has qualified staff on hand. Dr. Tim could go there, deliver babies in one of the rural mobile clinics. That's the legislation I propose.
Thank you, Mr. Taylor. All right. Injury-related deaths are 40% higher in rural communities than in urban communities. In our rural areas, ambulances can take too long to arrive, which in some cases can mean life or death. Have you thought about ways to address this issue? Starting with Davidson.
Right. That is a hard question because of the geographic location, but we do a really good job in rural areas of rural firefighters, right? So we have volunteer firefighter departments. So it is feasible that we could also have ambulances that can be at the point of an emergency and provide a timely delivery to the hospital so that someone doesn't perish or their condition doesn't worsen by the time they get to the hospital. I know that in Washington County, there was some talk recently that there may not even be a third shift EMS because of also there's an issue with retracting viable talent to stay on. So we have to improve access to educational opportunities so that people go into that field by increasing the starting wage. But this is a huge problem. A lot of people in my community work outside. We have loggers, and it's a problem that has to be solved, but it isn't something that I've specifically looked at and can provide you a solution today, but it is something that needs to be solved.
Thank you, Mr. Davidson. Mr. Meyer?
So, I had not heard that number 40% before, but it's not really surprising. farm jobs are significantly more dangerous than people realize, and one of the reasons is they're working around big machinery and a lot of equipment, and they are usually working alone or in isolation, so there isn't a buddy to help them find out. So there is a lot of problems with that. I liked the idea of his about more mobile clinics, and they did that in Western Indiana, and then the Republicans came in and then they gutted that program again. There is a systemic problem, that there are solutions to these problems, and they are undercut on a regular basis because of money and because of political ideology. One of the things that could help, you're talking about doctors training and EMTs, medical training should be free. It's extremely expensive to become a doctor and even a physician assistant. We need to have a significantly larger base of people so that we can get staffing into those areas, but most of it is going to be EMT help, and it's a difficult problem. I don't have a crisp answer, but more staff would help and more clinics.
Thank you, Mr. Meyer.
Rachel, would you mind repeating the question?
Yeah, of course.
Thank you.
Injury-related deaths are 40% higher in rural communities than in urban communities. In our rural areas, ambulances can take too long to arrive, which in some cases can mean life or death. Have you thought about ways to address this issue?
Yes, I've thought a lot about this. So, the other day was Halloween. My wife is the president of our beautification committee in our tiny town, and we throw the trunk or treat, and a child fell from a high distance and high height and hit his head. And 911 was called, and they said, "We don't have an ambulance for you." And so the family knew I was there, people ran and got me. I went to the patient, and they looked at me and said, "What do we do?" And I said, "Get in your car and drive." And they had to drive 40 minutes to get to the nearest hospital. Every EMS, firstly, should have a doctor on their shoulder through telemedicine. That's something that can happen. So that when a first responder shows up, whether it's EMS or a police officer or a fire person, they all can have the aid of a physician. Secondly, EMS workers, not many people know this, but for the most part are contractors. And because of that, they don't even get health care themselves. People giving you health care don't get health care. It happens for home care as well. Home care attendants who are giving you health care don't get health care. That should be illegal. That is taking advantage of working people. If we change that, we'll make the professions that much more desirable, and we'll have more people to help all of us. Thank you.
Thank you, Dr. Peck. Mr. Taylor?
Yeah, I think I'm gonna have to beat that rural mobile health clinic again. Beat that horse a little bit. You put care closer to the people, less people die. That's just it. Thank you.
Thank you, Mr. Taylor. Sorry, I keep wanting to call you by your first name. Indiana's rural areas face acute shortages of mental and behavioral health professionals and are still grappling with the opioid and substance use crisis. In a district with significant behavioral health provider shortages, how would you use your position in Congress to specifically increase mental health care in southeastern Indiana? Starting with Davidson.
Right, so the micro answer to this question is provide more opportunities for mental health. The macro issue is the fact that poor rural people in America are poor in everything. So it's not just mental health, it's all opportunity, and that's why I've decided to run with my slogan is Revive the American Dream, and it can't just be reviving the American dream for the people in the suburbs and the urban areas. It's gotta be providing an opportunity economy and investing in our rural communities again. And the opioid crisis. If you want to talk anecdotes, I have a lot of family members that have suffered from that. I have personally been affected by family members that have suffered from that. And it all comes down to opportunity. It comes down to economics, and it's a choice that we have made as a society to allow so many people not to have the opportunity to get ahead. So mental health and opiates, they're all related to the fact that some people feel like they don't have an opportunity to advance themselves. So we have to invest in these communities, and we can't ignore them, and we have to provide opportunities.
Thank you, Mr. Davidson. Mr. Meyer?
So you're talking about rural, repeat the question if you would.
Yeah, of course. Indiana's rural area faces acute shortages of mental and behavioral health professionals and are still grappling with opioid and substance use crisis. In a district with significant behavioral health provider shortages, how would you use your position in Congress to specifically increase mental health care in southeastern Indiana?
So there are two problems, and they're separable. One of them is how we handle addiction and mental health issues in this country as a whole. And then the overlay on that is the logistics of how do you address that in rural areas. And the fact is, if we start by looking at just generally how do we handle it, it's really, really poor. There's a lot of ideology behind this, that people that with mental illness are looked down upon, and they don't, and I don't mean this for me, but people view it as like they don't deserve care. We shouldn't, as a society, be paying for this care, which is completely wrong, because they need it, and there are times we all suffer and need help, and I think the complete lack of compassion for mental illness and the haughtiness of the attitude toward people with drug addictions is just appalling. And then the separable problem, which is the logistics in rural areas, it's the same problem that we've had in others. And again, it's just killing me, but I have to agree with Dr. Peck that telemedicine is important. And I have to agree with Mr. Taylor that these clinics are important. We need real solutions, and it's going to take some money. And the reason that we have not been able to get it done in the past is, number one, is it's not profitable. So in a for-profit system, you're allowed to suffer and die. And number two, ideology, because we feel that people, and this is to paraphrase there, lazy, crazy, and homeless don't deserve our health care. How can you look at that and say another human being doesn't deserve the care that they need? It is just unconscionable, and we have to break this mindset, and we have to get those people out of office. Thank you.
Thank you, Mr. Meyer. Dr. Peck?
We haven't called on Erin Houchin yet to say anything, but this one I really wish we did. We know what she would say on most things, but what you might not know is that she was one of only 39 congresspeople to vote against refunding the opioid crisis response in the country. That includes the things that we need, and we need to invest in more, which include rehab centers, telemedicine, treating people for withdrawal in the emergency department, Narcan in our communities and around any public space, including right here in this park, in case someone overdoses. That's an easy way to fund and make sure that people have more care. In terms of mental health crisis and shortage, it also comes to what is the root causes of our drug problems, of our mental health issues. And a lot of this comes down to having a roof over your head, having food in your belly. These things are crises in our country. We can build more housing. We can make sure people have SNAP. We can make sure people's needs are addressed. which will allow us to take people out of the cold, inside, and be able to treat them. A lot of our mental health crisis is because people don't have the resources to keep a home. And I see them in the emergency department every night. We need to address all of people's needs, all of people's rights, including their right to health care.
Thank you, Dr. Peck. Mr. Floyd?
Opioid addiction and mental health issues, they're all just health issues. And they should be covered like any other health issue. You shouldn't have to fight with your insurance company to go see a shrink or to get addiction recovery assistance. I think telehealth in that case would be very beneficial for a lot of people. And yeah, pretty much it.
Thank you, Mr. Taylor. All right, emergency room overcrowding and long wait times have become a major concern across southeastern Indiana, with many facilities reporting long wait times and high rates of patients leaving without being seen. While staffing is a core issue, some physicians argue that simply adding more support staff, such as nurse practitioners or physician assistants, will not solve the problem if state regulations require a supervising physician to personally sign off on every patient's chart, effectively creating a new bottleneck. To reduce wait times, what specific federal policy would you prioritize? And starting with Davidson.
So, I am of the rural poor here. I spent most of my life that way, and as I said in the beginning, when I had to miss school when I was a kid, I missed a lot of school as a kid. And it got to the point where the principal said, to my mom, hey, he's missing too much school and he doesn't have a doctor's note. So my mom would take me to the emergency room. A lot of Americans use the emergency room as their primary care provider. So first we have to provide access so that that's not an option, that people don't feel like they have to go to the emergency room to get routine medical care or if they have an issue. So we have to invest in clinics. We have to invest in telehealth. We have to give people the right to health care. I think if we do those things, then the use rate of emergency rooms goes down. So I think the real issue at hand is here, and the real solution is the same solution that I said and most of us have said at the beginning.
Thank you, Mr. Davidson. Mr. Meyer?
So up until this point, I've been pretty happy with him going first because it gives me time to think about my answer before I have to actually speak. But unfortunately, he stole a little bit of my thunder this time, so I'm not feeling quite as good about it. People using the ER as their primary health is a serious problem. And that's why the clinics and the telehealth and all the other things that we've all been talking about, and sometimes violently agreeing about, is necessary. So if you reduce the amount of people that are using it as their primary health, that is going to help dramatically, and the policies that I'm advocating for, I think, will do that. The other one is, if everyone is covered, then they can go when they're not feeling well instead of when it's a really serious problem. Dr. Stone is around here somewhere. He's over in the corner. He tells a story, and since I got the mic, I'm going to steal his story, about a guy that came in and he had a problem, I think, with his ankle. And Dr. Stone said, well, we need to get an x-ray. He's like, oh man, I can't afford that. And it was obvious that it was a break, that if he had gone in and gotten care immediately, it would have been okay. But it had been allowed to fester, and it had gone so long that there was additional damage, and now it's a much bigger problem, and it's a surgery. See, I was paying attention, Dr. Stone. And there's a lot of that as well. If we can get people primary health care that they don't have to wait, it'll reduce some of the load in the ER. If we can get them so that they can go to another place instead of the ER, that would also help. more doctors, more physician's assistants, more nurses, more support staff. Maybe it wouldn't help in one site, but it would help if there were more sites. Again, we need to have more sites, and with all the hospitals closing down, more people are going to be funneled into fewer resources. So it's a resource problem, and we need to reverse it. Thank you.
Thank you, Mr. Meyer. Dr. Peck?
So I've been called a number of times around telemedicine, so agree with me around telemedicine. I'd like to tell my story around that. So in about 2011, before telemedicine was a thing, I invented telemedicine, and telemedicine company and practice that treated patients in nursing homes. We literally had to make the technology from scratch. And in order to learn everything I could about nursing homes, and I was particularly interested in nursing homes because 19% of the patients that come by ambulance to an emergency department originate from a nursing home. And so I went and I actually lived in a nursing home for 3 months. And if you don't believe me, there's a CNBC article out there about it. And what I learned there was that people didn't need to go to the emergency department. Doctors needed to come to them. And so we created this telemedicine system. And by doing this, we scaled it largely across the country. And we actually saved Medicare $100 million doing it, treating and overseeing the care of 5,000 people a day. And so that's what brought me to DC. I went to DC and I started working on legislation and helping others work on their telemedicine legislation, and 5 bills were passed. And it's why hundreds of millions of people were able to use telemedicine during the pandemic. I'm extremely proud of the work that we did to get there, and it's really what led me to be on the stage and have the experience to do it. There's more legislation out there to expand this and be able to decrease overcrowding by getting to people at the moment of their emergency, getting to people before they get sick through telemedicine. It's already written. I wrote some of it. And when we open the government again, and you elect Democrats to Congress, we will work on making that a reality. Thank you.
Thank you, Dr. Peck. Mr. Taylor?
I think we've all said basically the same thing. Make sure everybody has coverage, move the care closer to the people, and make sure that they're covered sooner, that people actually see the doctors they need when they need to see them, and there will be no more emergency room visits for non-emergencies. Thanks.
Thank you. All right, what would you propose to handle the lack of funding for VA services? Starting with Davidson.
I kind of like simple solutions. I'm not sure about you. I think we fund them. We empower them. We talk about chronic homelessness. We have a problem with veterans who are homeless. We have a problem with access too. Here's another issue when we talk about rural hospitals, right? I can't think of a better way to improve access in rural areas than to invest with veteran clinics, right? I know a lot of veterans in Washington County. The nearest facility for that, especially for emergency treatment, is an hour away. And I'm sorry, but the VA does a very good job. And I think we're starting to see this. This is what I say to people all the time about Donald Trump and our current political discourse. I think that ultimately we're going to see that government does provide a better product. And sometimes you see that when someone tries to take it away. And the VA does a really good job, and I think we just empower it. But I also think that it could be part of the solution from a federal standpoint on how we improve healthcare access in rural areas.
Thank you, Mr. Davidson. Mr. Meyer?
So right now, the VA is, I think, doing a better job than it has, and it goes through cycles. It's doing much better, and then it's doing bad, and then there's a congressional investigation, and then it does better, and then it goes up and down and up and down. And it goes up and down because there are two pressures. There's one force that's saying we need to take care of our veterans, which I agree, and there's another force saying we need to sink any nonprofit government organized healthcare program, and we need to save money. And they strip as much out, and they hamstring it until to the point that it's ineffective. And when people start dying and suffering again, then there's a big stink, and it gets better for a while. But it gets better, and then it decays, and it gets better, and it decays. And the reason is there is no constitutional right to health care. We keep saying that it's a right, but it's not legally a right. It's not a right that we have, and we have not enshrined it in our Constitution. If we're going to get these people who are just trying to squeeze money out of the system, out of our health care, it's probably going to have to be a constitutional amendment in the long run. In the short run, we can put laws in place that force better visibility and better tripwires, but frankly, the VA and all of our healthcare systems are susceptible to these forces that are trying to destroy anything that is not for profit. And they spend millions and billions of dollars to buy Congress so that they don't have to compete with a system that works better. It is all about the politics. It's not about the care.
Thank you, Mr. Meyer. Dr. Peck?
Are there veterans and active service members here? Clyde? Ma'am, thank you for serving. My father was a Vietnam veteran, is a Vietnam veteran. And when I was growing up, he actually founded and created the first homeless shelter for veterans in the United States. Did this for the Salvation Army. And I grew up around a lot of homeless veterans, saw a lot of people not getting the care they needed. This has been an extremely important part of my life as a child, all the way to adulthood. And I've worked in VAs as a medical student, as a resident as well. One of the things that happens with the VA is that a lot of physicians outside of the VA system don't take their insurance, won't take those patients in. And the reason for that is that the VA doesn't pay them enough, and so they say it's not worth it. It doesn't cost much in the scope of 20% of our budget in America going to healthcare. It doesn't cost much in the scope of how much money we spend in the government to make sure that they are paying a fair rate to physicians and providers outside the VA system, because the VA system can't provide every single test that they need, every single physician they need, and when they're full, veterans should be able to use the community immediately. So funding directly to the VA to make their payments on par with at least Medicaid, if not what Medicare does, is the solution. Thank you.
Thank you, Dr. Peck. Mr. Taylor? Of course. What was your proposed to handle the lack of funding for VA services?
Simple, I just give them more money. I mean, the VA needs to be funded. We have a great population of veterans. We have a lot of military bases in the area. VA funding is clearly inadequate, and we should put more effort into funding it properly. Thanks.
Thank you. Members of Congress get special, cheaper health care than most people in our district. Do you think members of Congress should have to buy their insurance on the same marketplace as their constituents without extra taxpayer money, so they share the same challenges as the people they represent? Starting with Davidson.
I might say something controversial here, and actually I don't. I think that it's a position that we should send our best and our brightest to do, and we should incentivize it as such. They should They should be able to have health care just like I think every American should have affordable health care. So I'm not gonna carve out for just the politicians, but I will say, if you want to solve that problem, if you want to elect people that have the same struggles that modern Americans do, then you start by electing people that have lived those struggles. And that's sort of why I'm running for Congress. We need people that are working class Americans in Congress. We need young people that see the future and are struggling and wondering, are we going to live as good as our parents did, right? So if you want to solve that problem, we solve that as the voter. We solve that through electing people that relate to us.
Thank you, Mr. Davidson. Mr. Meyer?
So there's a saying in Physicians for a National Health Program, which again, I'm a member, everybody in, nobody out. So no, I don't think that they should be put into the same system. I think we should all be moved into that better system, every mother-loving one of us. So and that's one of the problems that we have, is that when Congress people vote on health care, they've got us broken up into little groups so that they can shaft or cut this group over here because they're not going to vote for me anyway, or I've got donors that need this special thing. But if every person in the United States was under one system, then they wouldn't be able to pit our interests against other people's interests, and they would have to live in that system. So if they say, I don't think that mental health should be covered, and then their spouse or their child or somebody they love has problems, then they'll begin to see the hurt that they're causing. Right now they have a special system, and they are not exposed to the same pain and suffering as the rest of us, and they also segment us. Again, there's a separate system for the prison system. There's a separate system for veterans. There's a separate system for people that are active duty. And so on. And the Native American has a separate system as well. And they squeeze it down until it causes suffering. And they can squeeze the veterans a little bit, but they can squeeze the Indian system a lot more because it's not as visible and nobody hears it. But if everybody was in the exact same system, they would hear it much sooner and much louder.
Thank you, Mr. Meyer. Dr. Peck?
I'm going to answer this question a little bit differently. Basically, you're talking about, do Congress people deserve a good benefits package? You know, do they deserve the ability to get health care straight from the government and us pay for it? And that's part of what they get for their benefits. But they also get the ability to do inside trading. They also get the ability to stay in Congress for as long as they can continue to get reelected. They also get the ability to work with corporate lobbyists for when they are no longer elected, they can work a large paying job. Benefits package for Congress includes making sure there's healthcare reform, making sure there's finance reform, making sure insider trading is illegal, make sure term limits are in place, and make sure corporate lobbying never happens again. Thank you.
Thank you, Dr. Peck. Mr. Taylor?
Absolutely, Congress should have to get on the same page with the rest of the population. The rest of the population should have coverage, but the Congress people should be on the exact same page. Thank you.
Thank you, Mr. Taylor. All right, we have reached the final segment of this important debate. The passion and detailed policy proposals presented today underscore just how vital healthcare is to the voters of Congressional District 9. Now, each of our 4 candidates will have one final opportunity to address you directly. They will each give a 2-minute closing statement on why they believe they are the best choice to represent you in Congress and lead the change on healthcare reform. We will once again proceed in alphabetical order by last name, starting with Davidson.
Yeah, I want to start this last part by saying that I think that everyone on this stage, and I think you would agree, would be a better candidate than the current one we have in office. What the people of the 9th District District, the people of the 9th District Democratic Party, we all have to make a choice on who we think best relates to the 9th District and the problems and struggles that people of the 9th District are having. And I wouldn't be running for Congress if I didn't think that I relate more. Just my backstory and what I've went through and where I come from, these people are my people. The people of the 9th District, every single one of them, I don't care if I disagree with them. I can sit down and I can have a conversation with them and we can leave not hating each other. I love the 9th District, I'm a proud Hoosier, and it's beyond time for us to have a public option and solve the healthcare crisis.
Thank you, Mr. Davidson. Mr. Meyer?
So I got into this race because when I was looking at when Trump came to power and started setting aside constitutional norms, I knew something had to be done, so I quit my job so I could run for office. But one of the reasons that I quit my job and ran for office is when I looked at the last race, which we lost 2-1, Dr. Peck had publicly and privately said that he's not in favor of universal health care. After I started running and I started campaigning on this issue, he privately said to people that he's looking to sound more like he's for it. I am, as I've said before, a member of Physicians for National Healthcare Program because I believe in a single-payer, government-run system. I believe that you cannot have a for-profit system coexist because they have proven that they will steal the land under our feet if we allow them. And I've also heard, that this is a nonpartisan thing, and unfortunately, that's kind of true because it's Democrats and Republicans that have allowed this to continue. But Democrats have done a lot to put the Affordable Care Act in, and I think, different than maybe the other candidates because I believe we need to be fighting for a bigger picture. We have to stop small ideas lead to small votes, and we need to start advocating for something much better and much stronger than what we've had in the past. And medicine is nonpartisan, but this problem is very partisan, and it's not the Democrats that are taking these things away from us, it's the Republican Party, and we need to be honest about that. Thank you.
Thank you, Mr. Meyer. Dr. Peck?
Here in southern Indiana, our days start early, for many of us. Before the sun rises, work has already begun. It has begun in barns, in kitchens, in classrooms, in factories, where people who still believe in showing up. We don't wait for help to come from somewhere else. We take care of each other. We take care of each other because that's what neighbors do. When a family's hurting, a meal appears at their door. Around here, in this community, that is not charity. It is community. But the truth is, it's getting harder and harder to keep doing what we've always done. As we've talked about, hospitals are closing. Bills keep rising. Too many families are one illness away from losing everything they've worked for. And the folks in Washington, they talk, but they don't listen, and they are literally doing nothing right now. We deserve better than that. Hoosiers deserve better than that. We deserve leaders who know what it means to miss a night's sleep, to put others first, to fight for fairness, whether it's in a hospital room, a classroom, or a field. Because the strength of all of you, all of us, and of the state isn't found in the marble halls of Washington, D.C. It's found in your hands, the hands of working people, in the nurses, the teachers, the farmers, the small business owners, the students. The world is changing fast, but the values that built this place still hold. Work hard, tell the truth, look out for one another. I am Tim Peck, and I'm running for U.S. Congress, and I have something to say. Join me in the work worth doing, in the work of rebuilding trust, in the work of restoring democracy and decency and proving that all of us as neighbors can still shape a better tomorrow together.
Thank you,
so
Dr.
much
Peck.
for this opportunity, and I appreciate the moderator. Thank you.
Mr. Taylor?
Here's my promise. I will not ask you for one more dollar in taxes to fund another layer of bureaucracy. We'll move care close to the people, cut the waste, and publish receipts. Mobile clinics in underserved towns. Seniors finally get their teeth, eyes, ears, and meds covered without a maze of copays. Medicaid pays for real care, not middleman margins, and every dollar is tracked on a public dashboard. If an insurer or PBM wants your premium, they compete under clear benchmarks and public audits. If a hospital's price is double the district norm, it's on the record. If ER visits drop because we funded primary care, that shows up on the dashboard. And we reinvest the savings into frontline teams, not overhead. I'm running to make healthcare predictable, local, and fair, not someday, now. The bills are written, the math adds up, the oversight's built in. And you don't have to trust a politician's word. You can open the Congress app tonight, read the bills, see the numbers, and cast your support or opposition. This is not left or right. It's mainstream, taking back control. Thank you.
Thank you to all the candidates for participating and everyone here today on this chilly autumn morning, and everyone watching at home. Have a great day, everyone.